My name is Janine, and I am 45 years old now, although I don't feel like I'm 45. I feel like I'm 26. But anyway, um, I grew up in the Gulf, and I have a sister, my parents, and now I have a husband and two children. And thankfully, I am now 7 years seizure free. So I wrote a book explaining to people, spreading awareness, and wanting people to know that this is not a shame or a taboo. It's just a disorder. My first seizure was a grand mal seizure, and I was 13 years old, and I was on the way to a volleyball game with my friends. And as I was getting off the bus, that's where the grand mal seizure started, and I fell to the ground. And of course, my friends freaked out. And one of them, though, was, I guess, had the courage. She put a bag under my head, and well, I mean, she was very helpful, while other people ran to get the coach. And so that's how my first seizure happened. And then obviously I went to doctors. I did all sorts of tests, MRIs, EEGs, CAT scans, blood tests, back and forth. And then a few days, I mean, between the first and the second seizure, I had another grand mal seizure, which confirms it's epilepsy, because usually 2 or more seizures means you have epilepsy. So yeah, that's how I was diagnosed. Well, for me, I've taken many medications, and I've done alternative medicine, which is I've done Reiki, Chinese acupuncture, and attunement therapy. And I've taken many different medications, starting with Tegretol, and then Depakine, Topomax, Lamictal, and Capra, a generic for Capra. And my seizures are drug resistant, so my only hope was surgery. And I was very much against for a very long time, but only a fear of what, the outcome later on. But then 25 years down the line, I decided it's either now or never, because waiting too long, you can't have the surgery, and my seizures can get worse. At that point, they're still at the right temporal lobe, single point in my brain. But if it spreads and they become, the center part of my brain, I can't have a surgery. Yeah, the side effects, well, there's many side effects that come with the medication. Some are worse than others, depending on the medicine. But 90% of all the medications I took had the same side effects, which were depression, crying. I have double vision. What else? There's also, well, with other medications, I also had paranoia, which was, a very big thing to deal with. The paranoia was difficult. And I also, very angry or nervous. And so, yeah, those were some of the side effects I can remember. But there's a lot. I mean, there's plenty. Well, I wrote this down because it's going to be very difficult to read the name of my surgery. It's kind of like the califragilistic with Mary Poppins, so I'm going to try really well. It's the amygdala hippocampectomy. That's the name of the surgery. And the surgery it's usually, it's the most common surgery for seizures that are originating from a single point in your brain. And what they do is they remove the entire anterior portion of the temporal lobe. And so not everyone can have this surgery, but I mean, most people with the same, diagnosis as mine would probably be able to do it. And it's very successful. Of course, it's not a decision you can make overnight, but it's for me, it's changed my life completely. There's 1% death rate. So that when I heard that, I kind of froze. But yeah, you can also get run over by a car. That's exactly my surgeon's words. So what else? You could go blind. You could lose your memory. There's many things, brain damage. And thankfully, none of that happened. And Also, the post-surgery recovery time, 40 days, but it's something you can actually, I mean, get past. It's not, you know, it's much better than staying with epilepsy. Since the surgery, I'm still on medication, but that's on my own accord. My doctor says it's good to stay on medication because, I mean, epilepsy is prone to come back. But if my seizures ever do come back, they will never be like they were before, ever. And it might just be an aura, but never turn into a seizure. So far, there's nothing. Besides the medication that I'm still on, it's changed my life because I went back to driving. I am more involved with my children's activities. I mean, they used to go to activities, and I sometimes used to take them to the park walking, but you're more involved, and they're so happy, you know, that you're involved. You know, they see you just like the other mothers. You're present. So that's really important. A lot of things that I had to depend on people, I do on my own, and I try to pay back everybody that's, you know, been there for me, even though I know I don't have to, but that's just me. And so I do my part. And what else? It changed my life. Yeah, it's amazing. It's you don't have to worry about epilepsy, you know, constantly worrying about having a seizure, and so it has changed my life completely.